Physiology students, it is time for our last lab on the skeletal system. Today we are doing the pelvic girdle and the inferior appendage. So we got a bunch of bones to do. What we've got here on the screen are a couple of pelvises. Got a couple of pelvises with some vertebrae thrown in for good measure. So we're not going to talk about these two lumbar vertebrae today, but we are going to talk about the male and female pelvis. We actually have one of each. Tell you how to distinguish them in just a moment. Maybe you can make a guess right now. Which one do you think is the male? Which one do you think is the female? Take a guess. All right, so if we're talking about the pelvis, we are talking about the hip bone. So this is a hip bone right here. This is a hip bone right here. The adult hip bone is pretty big. It's this entire thing right here. This entire thing is the adult hip bone. So that's a hip bone on the left. There's a hip bone over here on the right. Those two hip bones plus the sacrum and the coccyx, which we can't see, but we know it's under the sacrum behind this anterior joint here. Okay? So those four bones total, the two hip bones, the sacrum, and the coccyx, they are going to make up the pelvis. So that structure is the pelvis. Now in the pelvis, there are going to be four joints as well. So I'm going to have a joint between my sacrum and my hip bone, and that bone is called the sacroiliac joint. That joint, rather, is called the sacroiliac joint. So there's a sacroiliac joint on each side right there. The part of the hip bone that I'm writing on right now is called the ilium. We'll get to that a little more later, but that's why we call the joint the sacroiliac. Okay. There's also a sacrococcygeal joint, and you can kind of see it on this pelvis over here. It's right there. There's that sacrococcygeal joint, which we looked at in the last, not the last lab, but 2 labs ago. Lastly, there is the joint between the two hip bones in the front. The anterior hip joint here is the pubic symphysis. So we got 4 bones, 4 joints making up the pelvis. Now, bear in mind, we also have a term called the pelvic girdle. The pelvic girdle is just the 2 hip bones. So it's not all 4. So the pelvis goes all the way around. The pelvic girdle does not. Okay? Remember we had the pectoral girdle, which attached the upper limb to the axial skeleton? Well, the pelvic girdle is going to attach the lower limb to the axial skeleton. Also, remember we had 2 pectoral girdles, but we only have 1 pelvic girdle. Okay, excellent. By the way, did you have a guess which one was the male and which one was the female? Let's see if you're right. This one right here is the male, this is the female. Quick way to tell is look at the sharpness of this angle right here. It's a lot more obtuse down here. There's other clues too, but that's a good, quick, easy one. Okay. Let's move on. Talk about those 4 joints. I mentioned them a moment ago. So we have 4 bones again. Let's go through the 4 bones really quick. I got a right hip bone over here, a left hip bone over here. I got a sacrum right here. The coccyx is down here. It's just below that purple arrow. You can get like a little hint of it right there. So 4 bones, 4 joints. Green arrow is on the right sacroiliac joint between the sacrum and the right hip bone. Blue arrow, left sacroiliac joint between the sacrum and the left hip bone. Purple arrow on that little sacrococcygeal joint. And then the red arrow here, this one, on that anterior joint, the pubic symphysis. Sacroiliac joints are synovial. They don't do a lot of movement, but they are synovial joints, while the sacrococcygeal joint and the pubic symphysis are cartilaginous. All right, so those are our 4 joints. Now, we already did the sacrum in the lab on vertebrae, so that's good. We don't need to redo the sacrum today. But there are some things associated with it and associated with the pelvis that we still have to do. The space that is protected, that is created by the pelvic bones, is separated into two different regions. Okay? So what I want you to do is to check out this dashed line right here. This dashed line running from, the sacrum, doesn't matter where you start. We can say, all right, from the sacrum all the way around both hip bones back to the sacrum. And this is the sacral promontory right here sticking out. So that line, that ridge right there is called the pelvic brim. Now, above the pelvic brim, so from this space all the way up to the top of the hip bone, so all that space from this blue line I just drew up top to this circle right here, that is your false pelvis. Now, your space below the pelvic brim, so your space from in here all the way down here, the space in there, that is the true pelvis. Okay, so we got true and false pelvis and the pelvic brim there. Let's look at some of these hip bones. This is an adult right hip bone. We'll talk about figuring out if it's right or left in a moment. The adult hip bone is a single solitary bone, as you can see here. When you are a kid, you have three separate smaller bones. They're going to start fusing together in puberty, and usually by the time you are in your mid-20s, you have just one complete solid bone. There are three hip bones originally in the child. They fuse together to form one in the adult. The three originals are the ilium, the ischium. Note the pronunciation. I don't want to hear you saying ischium or ischium. It's the ischium and the pubis. So those are the three original hip bones. Okay, this is the ilium region of the hip bone. So originally this was the iliac bone. Okay, the ilium. You can see the hip socket here. You basically take the top half of the hip socket and everything above it, and that's the ilium region. All right. Imagine going from the middle of that hip socket, right there, and then drawing a line halfway through this big foramen. And this region that's left over here, this like little quadrant here, is called the ischium region. It is going to be thicker than the corresponding region on the other side. So this is the ischium region. So remember, the top up here was ilium. Then we're dividing the bottom here into two separate parts. All right, the other side, so you take that other quarter of the hip socket and you go down and half that foramen and the skinnier part over here, that is the pubic region. It was originally the pubis. Okay, if we look at our ilium region, there is this rough superior edge up here called the iliac crest. If you put your hands on your hips, if you can feel that hip bone in there, that is your iliac crest. A lot of your ab muscles, a lot of back muscles are going to attach there. It's also where you get bone marrow. Like if you're donating bone marrow, it is a common harvesting site. All right, so that is the iliac crest. The hip socket, we mentioned that earlier when we were distinguishing the three regions. And the hip socket is better known as the acetabulum. The acetabulum. The acetabulum, The word literally means cup for vinegar. So in ancient Rome, there was a condiment dish. You would put vinegar in it. It was called the acetabulum. Somebody thought this hip socket looked like it. Hip socket articulates with the head of your femur. This is analogous to the relationship between the humerus and the glenoid fossa of the scapula. Although note, the acetabulum is deeper than the glenoid fossa. This is going to create a stronger hip joint compared to your shoulder joint. And the strength is good because of the increased importance of support for this role, for this joint. Okay, that's the acetabulum. What else do we got on this guy? We got this foramen down here, this big, impressive looking foramen. It is called the obturator foramen. Obturator foramen. Now, it looks pretty awesome, and people are always like, oh, what giant blood vessels and nerves go through there? But the word obturator basically means to cover up or obscure. And if we look at that other picture of the hip bone there, we can see, if we look right down here, we can see this is the obturator foramen right here. And most of it is covered up, blocked up. That's a good definition for obturate. Most of it is blocked up, is obstructed by this membrane. And there's only a little cavity here for an artery, vein, and a nerve to go through. All right, so it's the obturator foramen. Looks big, but it's not. Remember, you don't want to obturate traffic. You don't want to obstruct traffic. That's what obturator means, because there is a membrane blocking, obstructing this passageway. Okay. Moving right along, we have this big, rough projection. This is called your ischial tuberosity. This is your ischial tuberosity. It is big and rough. Your hamstring muscles attached to it. You know your hamstring muscles are the ones in the back of your thigh. They're the ones you will stretch if you are, doing a toe, if you're doing a toe touch. Ischial tuberosity is what you're actually sitting on right now. If you're sitting, I'm assuming you're sitting with a semblance of good posture. If you are sitting down and you're kind of sitting straight up, and you put your palms under your butt, you may or may not be able to feel your ischial tuberosities pressing into your palms. Depends on how bony of a butt you have. But your ischial tuberosity is where you sit. It is where hamstring muscles attach. There's an important ligament that grabs on there as well. Okay, what else do we have in this hip bone? Oh, I flipped it over. How can you tell I flipped it over? Well, you don't see the hip socket anymore. You don't see the acetabulum. And if you flip it over and you look on the ilium, you are going to see a region called the auricular surface, this rough region right here in the red here, all this. This rough ear-shaped region, we've seen something similar to this. We met the auricular surface of the sacrum. This guy right here is going to articulate with the same named surface in the sacrum to form the sacroiliac joint. Okay. By the way, since we have this picture, it's a good time as any to point something out. As you look at this hip bone right here, I want you to ask yourself, which way is that auricular surface pointing? To your left or to your right? Well, that auricular surface is pointing this way, which is to your right, which means this is a right hip bone. So I will show you, if I'm going to ask you about this, I'll show you a picture in this orientation and say, hey, is this right or left? You would say, Oh, that auricular surface is pointing to my right, so it is a right. Boom, you're done with that question. Okay, let's keep going. Anything else in this hip bone? I think there is. Yeah. In this front middle part, this is like the anterior medial part here, we have another rough surface called the symphyseal surface. This is where my two hip bones articulate in the front, that anterior hip joint. This is the joint formed here is the pubic symphysis, which you know is a cartilaginous joint. Now, both the joints we just talked about, both the joint surfaces we just talked about are rough because roughness is going to do what? Is going to restrict movement. Why do we want to restrict movement in our hip joints? Our pelvic joints, rather. This is to create more stability. Okay. Awesome. We are done with the hip bone. Hooray! We're done with the hip bone. All we got to do is a lot more bones. Guess we got 30 more bones to do. So, now we got the femur. This is the proximal femur right here. Got the head of it with the red arrow on it. Look at the smoothness of the head. Smoothness of the head is going to articulate the smooth acetabulum to form the hip joint. I just noticed a mistake on this. Please forgive me for writing hip joint. Hip joint. There we go. So head of the femur articulates with the acetabulum of the hip bone to make the hip joint. All right, if there's a head, there's probably a neck. So we got the neck of the femur here. At the neck of the femur, constricted region that joins the head to the shaft of the femur. Okay, what else do we got on this guy? We got this bulging thing. This is called the greater trochanter. This guy is the greater trochanter. You may or may not be able to feel your greater trochanter on the kind of the outside of your upper thigh, outside of your hip region. Greater trochanter is where a bunch of glute and thigh muscles are going to attach. All right, if there is a greater trochanter, what else is there going to be? Yes, you guessed it. There's going to be a lesser trochanter. Pair of muscles grab on there, muscles that flex your hip. Imagine like bringing your knee up towards your chest. That's flexing your hip. So muscles that do that attach to this lesser trochanter. Lesser trochanter, more medial and a lot smaller. Greater trochanter, more lateral and has a lot more bigness to it. Okay. I flipped it over and I went to the bottom side, the distal side of the femur. So I'm looking at the back bottom here. Got a posterior view of the distal femur. There is actually like a ridgy line. There's a ridgy line. It's kind of sharp. It goes, oops, doesn't go off to the side like that. I just can't draw a straight line. That's a horrible line right there. You know what I should do? I should erase that line. That's a garbage line right there. So this line, right, this whole thing right here, going both ways, that is the linea aspera. It is going to be an attachment point for muscles that adduct your thigh. Adduct your thigh. What does that mean? Well, if you did the joints lecture already, you know to adduct your thighs is like to bring them closer together. Imagine like trying to squeeze your knees together. You're adducting your thighs. Plus your quads are going to anchor here as well. Not all four of them, but some of them. As well as your big butt muscle, your gluteus maximus. Okay. Awesome. Here we see the parts of the femur that articulate with the tibia to form the knee joint. This is the lateral condyle of the femur. It's going to articulate with the lateral condyle of the tibia to form part of the knee joint. Now, if there's a lateral condyle, there's also going to be a lateral epicondyle above it. This is where we have a ligament attached called the fibular collateral ligament. It's going to grab onto here. It's going to go straight down and attach to the fibula below to strengthen that knee joint. And we'll actually look at that ligament a little bit later on. So on the lateral side, we got a condyle, and then we got a little bump here that is the epicondyle. So on the medial side, you can probably figure out what's going on. There is going to be a medial condyle of the femur, which is going to articulate the medial condyle of the tibia to help form that knee joint. And above that, there we go, there's an epicondyle, which is going to attach to the tibial collateral ligament, which comes straight down here and anchors the femur to the tibia. We don't want too much side-to-side motion at the knee, and those ligaments help to prevent that. All right. Almost done with this femur. If we flip it over to the front, we got this smooth region right here. This smooth kind of oblong region here is called the patellar surface. This is where this articulates with your kneecap or your patella. Your patella glides right there on that patellar surface. Okay. Folks, we're done the femur. Yes. Now we got the tibia. You know what? I'm going to backtrack for a second. Forgot to sell you something. It's all right, though. Well, there this picture will do. So take a look at this femur here. We're looking at the front of the femur here. Okay? I can see that greater trochanter really beautifully in the front. When I'm looking at the front of the femur like this, I ask myself, which way is the head of the femur pointing, to my left or to my right? It is pointing to my right. Thus, this guy is a right. Just wanted to make sure you knew how to do that. And now we are on to the tibia. You got the whole tibia right here. Come back to this picture in a moment. What we are going to do is zoom in to the proximal part. I was trying to draw a circle right there. That's not a circle, is it? I'll use this guy. We're going to zoom in on this proximal part. We actually flipped it around as well. And we can see these two indentations, blue and red arrows here. Got the medial and lateral condyle of the tibias. They're going to articulate with the condyles of the femur in order to form the knee joint. All right. There's more to this guy, though. There's more to this tibia. There is this bump in the front. This bump in the front of your tibia, right there. There we go. This bump right here. This is called the tibial tuberosity. It's where your patellar ligament attaches. If you bend your knee like slightly, you find your patella, like put some tension in your quad as you bend that knee halfway. So like, let's say, are you sitting down right now? Are you sitting down? Hopefully you're sitting down. Hopefully you're sitting down in a lovely chair like such. That's just a beautiful, comfortable looking chair right there. And this is you. Bum, bum, bum. There's give you a head. Dun, dun, dun. You're happy. And there's your knee. There's your knee right there. So get your foot off the ground. You don't have to do this with both feet. You can put the other foot down, actually. I'm sorry. You don't have to. There we go. Let's get like that. And you have another arm here. You're holding your computer. Dun, dun, dun. You're holding your computer. That's a horrible computer. There you go. You're magically holding your computer by the keyboard somehow. I don't know what you're doing. But let's say you put your knee like this. Let's say you put your knee like this and you're holding your foot off the ground so you can get a little tension in there. If you find your kneecap, then walk your way down. Like you can pinch your patellar ligament. And what that does, that patellar ligament, it attaches your patella, your kneecap, down to your tibial tuberosity, which you might be able to feel on your tibia. Like I'm pretty bony, so I can feel it pretty well. Give it a shot. Okay. Excellent. Jump down to the distal side. On the distal side, we have this bump called the medial malleolus right here. Malleolus means little hammer. And this bump is going to articulate with one of your ankle bones, this ankle bone called the talus. Also muscles attached there, and an ankle ligament. If you actually go down to your own ankle, that inner bump, you know how you have like an outer bump and an inner bump in your ankle? That inner bump on your ankle is your medial malleolus of your tibia. If I jump back a page here, there we go. Whoops, not forward. Let's jump. If I jump back a page, I can see the medial malleolus down there. There's that medial malleolus right there, right? Okay, now I want you to ask yourself, is this medial malleolus pointing to your left or pointing to your right? It's pointing to your right. So that means this is a right tibia. Okay. Excellent. Hey, we're done with the tibia. And now we got this skinny bone that's lateral to the tibia called the fibula. The fibula is a lot skinnier than the tibia because the fibula doesn't really support much weight at all. Now, the proximal fibula has this head right here. It's not going to articulate with your femur at all. It doesn't play a role in the knee joint. The only bones that play a role in the knee joint are the femur, the tibia, and the patella. But the fibula articulates with the tibia. So proximal fibula will articulate the proximal tibia. If I jump to the other side, the distal side of the fibula, I see this sticky out part down here. That is the lateral malleolus. Articulates with the talus, just like your medial malleolus did, and anchors several important ankle ligaments. Now, if this is your outer ankle bump, so if you find your outer ankle bump, you found your lateral malleolus. Okay, now we are going to look at the knee joint. So if I'm looking at the knee joint here, I can see my femur, my tibia. I don't really see the fibula yet. I see the patella hiding right there. So I'm seeing the three bones of the knee joint here. I can see the condyle of my tibia here and the condyle of my femur right here. I can see the epicondyle. You can see that medial epicondyle. It is right here where this ligament is attached. So what else we can see, something new that we can see, is this guy up here. This is called the quadriceps tendon. It is going to articulate, not articulate, but connect your quads, so your quadricep muscle, your anterior thigh muscle, to the superior surface of your patella. Now there's more to see on this knee model. Down below we have the patellar ligament. We mentioned this a moment ago. Patellar ligament is going to anchor the patella to the tibial tuberosity, which is right there. So the quadriceps tendon kind of becomes the patellar ligament. Okay. We have more ligaments to do. On the tibia side, connecting the tibia to the femur is this tibial collateral ligament, also called the medial collateral ligament. It is going to stop your tibia from sliding laterally. Don't want your tibia to do that. Okay. Whoops. If there's a tibial collateral ligament, a medial one, Hey, no surprise, there is also a fibular one. There is a fibular one as well. So connecting the femur down to the fibula. And we can actually nicely see how the fibula articulates with the tibia right there. So the fibula is not articulating with the femur, it is articulating with the tibia. And the fibular collateral ligament or lateral collateral ligament is going to attach that lateral epicondyle to the head of the fibula. There are actually two more ligaments we're going to do. And we'll get to them in a second. We've opened the knee joint here. So the patella is right down here. Here's the patella over here. We kind of like pulled the patella away, then bent the knee joint back really well. And I can see the two femoral condyles here and here. I can see my tibial condyles here and here. And in between the femoral and tibial condyles, we're going to find these sort of crescent-shaped pads of fibrocartilage. Each of these is called a meniscus because it has a crescent shape. This is what meniscus means. Maybe you met that word when you were doing like a chemistry class or something. And this crescent-shaped piece of fibrocartilage, the meniscus, this is the lateral meniscus, is going to provide cushioning and shock absorption. So lateral meniscus, cushioning and shock absorption between the lateral condyles of the femur and the tibia. Now if we flip to the other side, we see the medial meniscus giving us cushioning between the medial condyles of the femur and the tibia. Okay, fantastic. Now we can do two more ligaments. Got the posterior cruciate ligament right there. So it runs from the back of the tibia to the medial condyle of the femur. Prevents like back and forth motion at the tibia and femur at the knee joint. So that is my posterior cruciate ligament. The word cruciate is used because we have a pair of ligaments here that form an X that cross one another. That's what cruciate means. There's the anterior cruciate ligament. Again, preventing back and forth motion at your knee joint. It is going to start from the front of the tibia. So the anterior refers to the side of the tibia that we're starting on. And it runs to the lateral condyle of the femur. All right. Anterior cruciate ligament. Maybe you've heard of the ACL. People sometimes tear their ACLs. They bend their knees in a wacky way. Okay, guys. Good news. We're almost done. All we got to do is like 24 more bones. That's it. And we have a group of bones here called the tarsals. They are your ankle bones. There are 7 of them. Note that there were 8 wrist bones, 8 carpals, but there's only 7 tarsals. They're, of course, going to connect your leg to your foot. Now, we are going to learn just 2 of them. First one we're going to do is this guy right here. This guy right here is the talus. He is a nice bone. Sits underneath basically your tibia. Also articulates with your fibula. Going to articulate with those malleoli to form your ankle joint. Underneath it, there is a bone called the calcaneus. We see the calcaneus down here. More on the calcaneus in a moment. Anteriorly is another tarsal bone the talus articulates with right there. So your weight goes straight down through your talus into your foot. All right. We mentioned that calcaneus a moment ago. The calcaneus is your heel bone. It's going to articulate superiorly with the talus, anteriorly with another tarsal bone. If you can find it, see if you can find your calcaneal tendon. It's running from your heel bone, your calcaneus. You can feel that calcaneal tendon. Also called the Achilles tendon. If you know your Greek mythology, if you know your story of the Iliad, There was, of course, the great warrior Achilles. And this is basically what he looked like right here. He fought, of course, in the Trojan War. And he was killed by an arrow. And where did that arrow land? That arrow struck him in his Achilles tendon, which was his one point of vulnerability. Okay, so that's why it's called the Achilles tendon. All right. Glad we talked about that. That big tendon lets your big posterior calf muscles pull up on your heel bone, like when you are raising your heels off the ground, which you do every time you walk or you run. Okay, let's keep going. We're skipping the rest of the tarsals, of course, and we're on to the metatarsals. The big toe metatarsal is number 1. The pinky toe metatarsal is number 5. Going to articulate with a group of tarsals and articulate with the proximal phalanges right here. Speaking of phalanges, our big toe is going to have 2 phalanges. This is the first proximal phalanx, and then there's the first distal phalanx. Now our other toes are all going to have 3. So here's our second proximal phalanx, there's our second middle phalanx, and there's our second distal phalanx. There we go. And it would proceed similarly for the third, the fourth, and the fifth. Guys, we're done. We are done. All the bone labs. Fantastic. Give yourself a round of applause for sitting through all these lab videos, especially if you sat through all of them. Next thing up is your bone exam. So study for that. And hit me up if you got questions, email, office hours, whatever it takes. All right, guys, it's been fun. I'll see you next time. Bye-bye.